So it can be very embarrassing. It can be very embarrassing when you experience this. You are sexually aroused, you are not achieving an erection. Your penis is not responding to the stimulation. Let's say you are lucky enough, you achieve an erection, and then it is not firm. It is not rigid enough. What an embarrassment. Or you achieve an erection, it's firm, but along the way you lose it. And once you lose your erection, definitely, what about the climax, the orgasm? Hautafika kileleni. You won't reach orgasm. Na kama we mwanaume hautafika kileleni, pia mwanamke wako pia hatafika kileleni. Na hii inaweza leta shida ya kwanza. Now you can make your partner to think of getting the satisfaction elsewhere. Unaanza kumfanya afikirie sasa kama huyu anitoshelezi, ama every time we initiate this erection, this sexual activity, it's not working out. Anajiendea nje. So it's a serious problem. It's a serious problem. So these are the signs and symptoms of someone who might be having erectile dysfunction. Loss of interest, especially loss of interest. Libido is very low. Kuna shida. Iko shida ndugu yangu. Iko shida. So how can we diagnose erectile dysfunction? Of course, we have to get your medical history. How is your medical history? Do you have underlying health conditions? Do you have heart issues? Do you have kidney problems? Do you have diabetes? Your comprehensive medical history. Then we also need to get physical exam. We need to do physical examination, including checking your genital health. How is your genital system? How is your reproductive system? Do we have serious health concerns in your genital system? We also need to do some lab works. We need to do tests like checking blood sugar levels, the RBS, because we say diabetes can be a factor, a physical cause of erectile dysfunction. We need to check the levels of RBS, the cholesterol levels, and also the hormone levels in your system. We can also do psychological assessment, because we said we have physical causes and the psychological causes. We also need to do psychological assessment to check whether you are stressed, do you have depression, any psychological issues that you may be going through. We also can do what do we call it? There is this test that checks for erections at night. It's called nocturnal penile tumescence. Yeah, nocturnal penile tumescence, NPT test. This one looks at assesses the erections at night when you are asleep. The normal erections, NPT test. I may not discuss it in length, but there is a test called NPT, nocturnal penile tumescence, that looks at how are you erecting at night when you are asleep. So these are some of the ways of diagnosing what erectile dysfunction. So what are the treatment options? I want to combine treatment and prevention. I want to combine them. So we have first, lifestyle. Check your lifestyle. What about your lifestyle? Mwanaume, check your weight. Kama uko na weight mingi, cut your weight. Because when you are overweight, my friend, you are going to affect hormone production. This overweight can lead to blockage of your arteries. The blood supply can be affected. So check your weight. Number 2, do exercise. The exercise can improve cardiovascular system, the blood flow. Yeah, the exercise is very important. At the same time, the exercise will help you cut your weight. Another thing about lifestyle, avoid I will not say reduce. I will say avoid. Avoid alcohol. Avoid bangi. Avoid miraa. Avoid cigarettes. Avoid any stimulant. Anything. Substance abuse. I know that is where the main problem is. And some people maybe will throw stones at me. But I have to tell you the truth. You are killing your sperms. You are killing your arrows. You are destroying your arrows. You are destroying your sperms. And your quiver will be empty. Unataka kwenda field na una mishale, unaenda kufanya kazi gani? Ama utatumia the quiver to beat your enemy? No, it doesn't happen that way. You have to avoid. And lastly, about the lifestyle, you can check on your diet. Eat a balanced diet. You need food. Yeah? Unahitaji ugali bwana. Rarua ugali. You need energy. Sexual intercourse requires energy. You have to eat well. Balanced diet. Because when you become weak, the blood vessels, what about them? They can also become weak. You don't have the physical energy itself. The blood supply will be affected. And so on. So lifestyle. Now, from the lifestyle, we can do medications. I don't want to discuss the medications because the medication will be given according to the cause. We treat the underlying cause. So I'm not here to discuss the medications. But if you have concerns, you can visit a doctor. You discuss the medications. Apart from medications, you can do psychological counseling. Yeah, psychological counseling. Maybe your inability to perform is because of stress, depression, and anything psychological. You need to get counseling from a professional counselor to give you tips on how to handle life issues. Maybe one more, you can do hormonal therapy. If the cause of erectile dysfunction is because of low testosterone levels, then hormonal replacement therapy can be done. So we may have other ways of handling this, but those are some of them. As I have said, check on your weight, check on your diet, check on the substance that you consume, do exercise. If there are healthy concerns, go to hospital, meet a doctor, physician, discuss with him or her and get the underlying cause. Then you will get the appropriate treatment. Hormonal therapy also replace the hormones and so on. So wanaume, msiniaibishe. Why do I say this? It's important to take care of your seed. Take care of your seed. It's very important. It's very crucial. What you carry is very important. Preserve your seed. Preserve your seed. Don't destroy your arrow. Avoid anxiety. Usikuwe na anxiety ya ati nitaperform. Usikuwe na pupa. Usijichoche. Take your time. And also, if there are issues in your relationship with your wife, discuss them openly. If the issues cannot be solved by the two of you, involve a third party. Counselors, spiritual leaders, involve them. Bring harmony in your relationship. Seek peace and understanding in your relationship to avoid psychological issues. And if there are physical causes, go to hospital for screening and get those tests, because it's something that we can do, we can sort it out. I hope from today, men, when you go to the field, you will perform. You will kill those antelopes, you will kill those dicks. Msiniaibishe. In case of questions, ask me, I will respond. Thank you so much for listening to me, and I will be bringing these topics to you men. Mkae choncho sasa. Ni wakati wenu. It's time to shine. So I'm ISHMAEL MBITHI, the founder and the director of MIVHT, Mtumishi ISHMAEL Volunteer Health Talks, an initiative that creates awareness to promote health. God bless you and shalom. Let's meet in our next episode. God bless.